I'm happy to share our results from our project assessing availability patterns of metastatic prostate cancer trials in the United States. So to start, we decided to research this topic because we found that there's a general trend that regions of the United States that are underserved tend to have less access to clinical trials. And for our methods, we started by identifying 534 interventional trials of enrolling adult patients with MPC trials from June 2019 to June 2025. For each trial, we wanted to record the specific area, so we used the United States Postal Service zip code data to map the locations to certain counties. Then, using this data, we used the CDC, or the Center of Disease Control, for a specific number called the Social Vulnerability Index score in order to characterize county-level socioeconomic vulnerability. Along with that, we used the National Cancer Institute, or the NCI, for the different prostate cancer mortality and incidence rates. Lastly, we used the U.S. Census Bureau for the population estimates. In order to put together all of this information, we used something called the zero-inflated negative binomial regression model. And we use this model specifically because a lot of areas, if you look at this map over here, the areas that are just completely white mean that there are actually no clinical trials in that county. So in order to account for a lot of these extra zeros and over dispersion, we use this regression model. And this regression model assess the relationship between the county level trial availability with the corresponding incidence, mortality, and SVI. So figure 1 shows a map of the different counties, and the ones that are blue are the counties with the more concentrated clinical trials, which are located mostly in metropolitan areas such as New York and LA County. Table 1 shows the regression model in a table, and we found a pattern that lower SVI had slightly more clinical trials. Figure 2 actually goes into state level and sees in what counties are there actually clinical trials, and surprisingly, Delaware was the only state to have a clinical trial in every county, and Mississippi only had close to 9% of counties. 9% of the population had a trial in their county. Figure 3 has 5 different mortality rate quintiles, and the quintile with the highest mortality rate actually were the counties with the least amount of clinical trials. So it's really important to keep this into account, and we actually, all in all, found that there was a distinct lack of the vast majority of U.S. counties, specifically the ones with the highest quintile of prostate cancer mortality rates. In the future, it's really important to keep this in mind when figuring out where exactly to put the clinical trials, along with developing community partnerships to reduce barriers such as transportation. Thank you.